Hello everyone, and thank you for making it out today. So I thought I would speak with you about symptom management. I understand that some of you have already started treatment and some of you have not, so I will try to speak about this as it pertains to everyone. I'm going to focus on fatigue as a very common symptom of prostate cancer therapy. There are many other side effects that you may or may not experience through your treatments, but because this is the most common, I will speak about this, okay? So the big question of what is cancer-related fatigue? And some of you who may have already experienced this may sort of understand what that gentleman is experiencing in the photo. So it's been described by patients that it's a feeling of tiredness that can last a long time. It can linger, so it generally can be months, but sometimes it can be for years. It may or may not go away with rest or with sleep, and it can get worse while treatment is actively being given. It can also range from mild fatigue to severe fatigue, and what we mean by that is mild meaning you sort of feel that it's there, going towards severe, which is where it actually impacts your day and prevents you from doing activities that you like to do, or even normal activities. It can come and go. One day you may feel great and think, hey, hurrah, the fatigue is gone, but then the next day it starts to creep back. And it's different for everyone. No two people are going to experience fatigue in the same way. So we've heard from many men that fatigue can make them feel very tired. They describe it as feeling weak or heavy or slow, worn out. They often, or sometimes, can feel that it impacts their ability to remember things. It feels like they don't have energy to do the things that they love, especially, and sorry about the bullet point, it shouldn't be there, but especially spending time with the people who matter most to them. And this especially included intimacy with their partners and their spouses. So what would cause it? You know, I used the word treatment, but it can be actually a multitude of different things. And this diagram actually comes from the fatigue booklet that would have come in your package. And if you don't have it, it's out on the tables outside the auditorium as well. So feel free to pick one up. It's got a lot of really great information in there. This fatigue booklet came from Cancer Care Ontario. And this page basically sort of tries to outline what can cause cancer-related fatigue or what can contribute to it. And it's almost like a web of different things. It can be one of these things, or it can be a combination. So the cancer itself, or the treatments, maybe other symptoms that a person goes through during treatment time, like nausea and vomiting or pain, or low blood counts, like low hemoglobin counts, okay? And maybe some of the medications that you may end up being on can also impact and cause fatigue or worsen it. I don't know how familiar this looks to any of you guys. So this is the paper form of where you would normally be directed to a kiosk to use a touchscreen and rate how you feel. And it goes by symptom, it's symptom specific. You won't find the word fatigue on this symptom screening tool. It's going to be under tiredness. And that's how the physician and the nurses and the team is able to know how you're feeling from a visit-to-visit basis on how your fatigue is. We can see the trends over time. That's why we ask you every time you come for a clinic visit to do this. And we can sort of compare how your fatigue was, for example, from one clinic visit to the next, if it's gotten worse over the course of a few months or a few weeks, and then if we need to sort of intervene in a different way to help you manage. We do it for the other symptoms as well on this too, but for this talk. So just some numbers to throw at you because we just love doing that. After a review of 8,290 symptom screens from the year 2015, it was discovered that fatigue was the most commonly reported symptom by men with prostate cancer, ranging from very mild to very severe. And if you want a percentage value, it's 67% of those 8,000. So how can you manage it? Either if you're feeling it now if you've been going through treatment or if you haven't had treatment yet, but you're sort of anticipating what to expect. One of the biggest things is to always communicate with us, with your healthcare team, your physician, your nurse, and with anybody that you may be seeing on top of that from patient and family support, whether it's a physiotherapist, occupational therapist, even if it ends up being a social worker, a psychologist, any member of staff that's involved in your care, you can communicate it. But the ones who can help you the most with fatigue or with symptoms will be your physician and your nurse. If you click on this link, and you can easily find it by Googling it, it will take you to our patient and family support page. Looks like this. A little bit busy looking, but it basically explains what patient and family support can do for you and the different options you have. And many men who experience fatigue have gone to our patient family support program to seek guidance or information or resources on how they can best manage. And there's sort of a list on the left-hand side of the screen where it says patient family support, about the patient and family support program, art therapy, drug reimbursement, and so on and so forth. And I think the most common professional that can help with fatigue will be our occupational therapist. She actually specializes in fatigue and strategies to overcome that symptom. And we have a physiotherapist as well. So this is our beautiful learning center. You may or may not have noticed it when you've come in through main reception, but it's our learning center, Patient Education and Research Learning Center, affectionately called the Pearl. It's located on the main floor next to main reception, and it's open from Monday to Friday, 9 to 4. You can also email that email address on the bottom if you wish to get more information. But basically, this learning center will provide lots of written information and resources on basically every cancer that we treat here at the center. And there's also strategies and resources on how to manage things like symptoms and like fatigue. What else they also have are classes. We have a monthly class schedule that the Pearl has posted in there. And these classes, there's actually a fatigue class that's run once a month or twice a month. And there is a nurse who specializes in fatigue management who will run the class and give strategies. So booklets, pamphlets, links to other support services, lots of stuff. And here is a visual of that fatigue booklet that I was telling you about. So here are some quick tips to manage fatigue, because you might be wondering, she's not getting to the meat of this. How would I manage it if I end up experiencing it or if I have it right now? So be active. We're not saying you need to go and start running marathons, but moderate exercise, whatever you can tolerate, because it will help to energize you, just like how it always did in the past probably. It will be the same for now or for the near future. Improve your sleep. The better you sleep and the better quality of sleep you get, the better rest you will get, and it will help to manage that fatigue. Whatever you do, pace yourself. You don't need to push the physical activity. Eat well. By eating well, I don't mean stuff your face and eat a lot. I mean eat good food. So you can always speak with our clinical nutritionists on what good nutrition is and how to boost up your nutrition health-wise. Managing stress and emotions, you already are in a very stressful situation right now. So if it helps to talk it out or to find relaxation strategies to help to decrease that, it can also help with fatigue, and then finding the right supports to do that. Most of all, just be very patient with yourself. It's a very trying time right now, and the hardest is when the therapy is active and you're really trying to battle a multitude of things and balance a multitude of things. So it's about being patient with yourself, and we are absolutely here to help you along the way, should you need it. Thanks very much for listening.
Thank you.